We're going to talk about the posterior lower leg. All right, this is the sole region of the body. That's why the gastroc and soleus together are known as the triceps surae. So you're ready for Jeopardy now. Give you a bonus points if you know why the hamstrings are called the hamstrings.
That's where they used to string up like pork legs by.
That's what the trail guide says, but that's not actually right. They hang cadaver pigs by their Achilles tendon, just like you would expect. The word ham is in Old German the name for the back of the knee. So they're literally the strings of the back of the knee. The back of the knee. Ham is an old German word for the back of the knee.
Oh, okay.
So.
That was close. Yeah.
Bacon.
That's right.
So there are lots and lots of things we can do for the lower leg, and a lot of the stuff that you guys are already doing is probably great stuff. Just like we talked about with other parts, the thumb can be involved, and grasping is certainly a thing, but I try to minimize that, obviously, since that's what the class is about. Recognize that the medial head of the gastroc is 90% of the problem. When people have a gastroc injury, it's almost always the medial head. It's larger and does more of the work, and it gets hurt more easily. There's also a huge correlation between trigger points in the medial head and heel and sole of the foot pain. I have a lot of patients that think they have plantar fasciitis because their symptoms look like plantar fasciitis and they've self-diagnosed it, or someone else has casually diagnosed it. Especially bad are primary care doctors, family doctors. They say, I get up, I have pain in my foot, it's sharp in the heel, and it's worse first thing when I step out of bed, or if I've been sitting a while, and they say, oh, it's plantar fasciitis, here's some anti-inflammatories, rest it. And in a lot of those patients, if you come in and work the medial head of the gastroc, you'll find spots that refer it exactly to where their problems are, and if you treat those trigger points, their pain will go away. So most of the time when I'm treating what looks like plantar fasciitis, I'm checking out the gastroc anyway. Even if they actually have plantar fasciitis, come in and check the medial head of the gastroc. The lateral head is, worth looking into, and you'll find trigger points in it, but it just doesn't seem to be as important for that heel pain. So take that for what it's worth. The gastroc and soleus are kind of interesting in that they're a good example of the fact that we have more than one kind of muscle cell. So we have fast twitch and slow twitch muscles, and unlike a lot of our muscles, which are a pretty even mix of them, gastroc is almost entirely fast twitch fibers, and soleus is almost entirely slow twitch fibers. So they don't really act in the same way. Gastroc is really powerful, but fatigues really quickly, so it's good for sprinting and jumping and that sort of activity. And the soleus isn't as powerful, but can fire all day long without fatiguing. So if you're running those marathons, that soleus is having to work hard. Soleus is tough to actually reach because it's buried under gastroc, so you work it indirectly through the gastroc. For this medial head of the gastroc, I like to do the forefinger to forefinger grasping whenever I can. So I'm going to take one hand and I'm going to slide completely in front of that medial head. So I'm right on the edge of the tibia. Be gentle if you're in this proximal portion, that pesant serine, where all of those muscles, the gracilis, semitendinosus, and sartorius attach, is very tender. So if I hurt you, let me know. I'll try to be gentle. So that hand hooks in front, and my other hand can come in from the back, and I can press through that gastroc and pull with this hand here. So I'm grasping just with my thumbs hanging out along for the ride. And I can find any taut, bands or trigger points in that to try to work. It's one of the few times where it's okay to use a little bit of a finger tip with grasping. A lot of grasping techniques we're using the pads of the fingertips and not the tips themselves, but with this forefinger we really want to curl the fingertips and get them in there. Try to prevent that hitchhiker thumb we all like to do. So try that on the medial head. You can do the same on this lateral head. You're just going to be hooking in that space between the two heads with one hand and coming just off the edge of the fibula with the other and doing this towards each other. Same basic idea, just the opposite direction. Nothing wrong with that. If you find a particularly tender spot or a trigger point and you want to treat that, a good thumb replacer is always that pip joint to come in. I like to stabilize the leg so I'm not pushing it down into the bolster, but depending on your bolster and your leg, you may or may not need to. Again, this table is way too short for me, and I'm usually standing up when I work on this area, but you can certainly sit. All 4 pip joints can be used the same way, and that same strumming action is fair game. Just be gentle. Scream before you kick. She's already unconscious. It's after lunch food coma. I like to use that 5th metacarpal head, I know, big surprise, and treat both heads as well. So I'll use that same kind of pushing, drag that 5th metacarpal head up into the muscle. Whether that's the lateral head, I'll come in this side and work in the medial head. Is that okay?
Yeah.
Borderline.
Yeah.
There's a tight spot right in there that could use some work. Your partner will get to play with that. The pisiform is also fine for treating just about any area you can work. Just again, be cognizant of how hard you're pushing down. You may want to actually grab the ankle and pull up gently just to resist that force. With the calf, it's a small enough area that it's easy enough to turn the palm a few different ways to get in there. So whatever fits their body and your body is fine. Same thing with the medial head. I can push up here or this way. And of course, it wouldn't be an area of the body you can work without getting the elbow involved. So I use the elbows a fair bit in here as well. This lateral head is easy to get from the side of the table. If it's too pointy, you can roll that arm and get a little more of the ulna in contact. Is that too much?
Yeah, a little bit.
Okay, I'll lighten up. Is that better? Working the medial head, you can reach over to get to it and pull back if you're on this side, or you can switch elbows and come in and work it with this arm. Again, not with the table at your knees, but just pretend I'm short. Anytime you're using the elbow, you've got the option for that jostle. Found that spot though. Definitely needs some work. When we move down to work on the foot, the same tools are all fair game. So it won't look all that different. It's just a smaller area. If you're a prone foot worker like I am, and you're not working on an adjustable height table, you can actually take advantage of the fact that the knee bends the way it does. So if I'm standing up and the table's at a good height for working on their body, but I want to work on their feet and I feel like I'm bending over, I can pick their foot up. It's easy enough to hold it in one hand and work it with the other. A lot of times, if I'm doing techniques that require me to actively extend the toes to work these deep flexors, I will bring the leg up into a 90 so that I can get in here and extend the toes with one hand and be working the sole of the foot with the other. But with a table this low, it's easy enough to sit down too. So if you have a lift table, you're all set. You can take your pick. For the sole of the foot, that 5th metacarpal head is another fun tool for the spot. And I use that almost everywhere in the body. It's easy enough to get in. Don't ignore the tarsal tunnel here on this medial corner of the foot. There's a lot of people who have issues with tarsal tunnel syndrome where the nerves wrap around. And so if you're treating the sole of the foot, don't forget that little area at the base of the arch. It can be fairly tender, so just keep an eye on your patient's comfort. If their toes start to curl up, then you've gone a little too hard. The feet are surprisingly durable, so it's one of those areas everyone loves to use their thumbs, and they're like, oh, this feels so good. And it does for the person on the table. You will tire out your thumbs working feet. So don't be afraid to get involved with other joints, other surfaces, rather. The pip joints are one of my favorite. I use all 4 of them, and I'll drag them from the heel down the foot, just like this. I tend to let the supporting, not too much?
No, it's amazing.
Good deal. I tend to support the foot and let both hands move together. So I'm getting a little bit of a plantar flexion of the ankle as I move. That's not strictly necessary. If you want to just move the top hand, that's fine. But I like that little tibialis anterior stretch that you get out of it at the same time. If there is a more specific spot, that second pip joint can come in and work it pretty easily. That can be static pressure or moving. Something I will often do is trace the tendons of the flexor digitorum for the toes. In a seated position, sometimes it's a little tricky to get the toe a bit stretched, but you can do it with any of the tools we've talked about. You just have to remember you're tracing to the tarsal tunnel. They don't run straight back like they do in the palm. So I'm starting over here near the first toe, and I'm tracking that towards that tarsal tunnel as I work, just like that. And then you can move over to the second toe and do the same thing, etc., etc. That one, actually, a lot of times I will do in this lifted position. So instead of using my pip joints, I'm just using a fingertip. So I'll extend all the toes together and reach in here with 1 or 2 fingers and drag back, just like that.
Do you have the toes flexed down?
Yep, they're just brought into an extended position there. So just tracing all of those tendons. This is one, again, a lot of people like to do with their thumbs. Nothing wrong with that. I'm just trying to spread that wear and tear out. Easy enough. The other thing that I do a lot for the feet that is worth playing with is using the olecranon process, using the elbow. Again, it seems kind of strange to take a big bony tool like your elbow to a small area, but the foot's pretty durable. You can be fairly aggressive as long as you communicate, especially if they're working into the heel itself. The heel can take like 9,000 pounds of pressure when you jump and land on it. So generally speaking, your elbow isn't going to be too much. If they're real tender and it's inflamed, you got to be careful. Is that okay?
Yes.
You can do that same kind of pulling motion with this, where you're tracking out the foot towards the toes. If it's a little too pointy and you want to try to use the blade of the ulna, that works just as well. It's a little broader area. I tend to like the olecranon, but on some people's feet, this feels better. And you know, it makes zero difference which arm you're using, just whatever fits your body and the patient's body. Good deal. So, quickly, we talked about grasping without any thumbs in the gastroc. We talked about using the 5th metacarpal head, point work with the pip joint. We talked about the elbow as well, and then we talked about all of those same things here. 5th metacarpal head, pip joints, elbows, and we added in some fingertips. So.